Sioux Falls' population hit a major milestone this year, reaching over 200,000 residents for the first time ever.
Well, city leaders say Sioux Falls saw about 6,700 people move to the city last year, with a steady 2 to 3% growth every year for more than a decade. What that boom in population means for the city's healthcare providers is the focus in tonight's Eye on KELOLAND.
The growth of this city is so amazing.
Explosive, really, if you think about it.
Unprecedented population growth coming right in the middle of a historic time in healthcare.
Not only has Sioux Falls been growing exponentially, it's been happening during and through a pandemic.
The combination of those two factors has meant a lot more work for anyone in healthcare.
Our urgent care is closed at 9 o'clock. There was times where it was open till 11:30 at night because there's so many patients coming.
Over the last couple of years, our walk-in volumes are up really anywhere from 20 to 40%.
It's meant some longer wait times, especially for certain specialty fields of healthcare. But both Avera Health and Sanford Health in Sioux Falls are doing everything they can to keep up with the growth.
By and large, I would say we've been able to meet the demands of the patients in this community.
That's thanks in large part to the long-term strategic planning both hospitals are constantly updating to make sure they have enough space to keep serving new patients who move to town.
These last couple of years, you've seen a lot of really projects or announcements that Sanford Health has moved forward with, and that's a result of this planning.
Sanford Health's Vice President of Operations, Andy Muntz, just announced the groundbreaking of a new medical building on Sanford's Central Campus, adding hundreds of parking spaces and an expanded GI clinic. Sanford is also in the process of building a new clinic in Harrisburg that's set to open yet this fall, with plans to begin construction on another clinic on the northeast side of Sioux Falls, continuing the past 5 years of additions to Sanford's facilities in the Sioux Falls area.
In 2018, we opened up our West Side Clinic. In 2019, we opened up our acute care at the sports complex. In 2020, we increased some inpatient beds related to that volume that we were seeing.
Avera McKinnon is almost full every day. And so we are looking at what is 2.0 out on Avera on the Wees.
Avera is also in the process of adding a long list of new facilities. The most recent announcement adding a new floor and another 26 beds to the brand new Avera on the Wees Specialty Hospital.
That hospital will be completely full after 3.5 years and through a pandemic.
Avera is also adding 4 floors and several new services to the behavioral health hospital.
We'll have addiction care for adolescents, that'll be new, and we'll have a 24/7 psychiatric urgent care.
Avera McKinnon CEO David Fleechek says the goal of these additions is to take some pressure and traffic away from the central Avera campus on Cliff Avenue and give more neighborhood access to emergency care.
We are excited about our Family Health Center at Highway 11 and 26th Street. That'll have family medicine, pediatrics, internal medicine, OB, and dermatology. It'll have a 7-day-a-week urgent care, and it'll also have a full-service emergency room.
It's similar to what Avera did on the west side of town, adding another team of emergency medical providers near Lake Lorraine.
We hire roughly around 40 physicians in the Sioux Falls market a year, and about another 30 advanced practice professionals.
To provide care, you have to have a workforce.
But while both health systems are building new facilities, their top priorities right now are recruiting more healthcare workers.
Year over year, we're really increasing our population of providers anywhere from 5 to 10%. So we're matching what we're seeing from a growth standpoint in the community.
There is some science behind how and when you add a physician. For every 2,500 new population, you could hire a family doctor. For every 5,000 population, you could add an endocrinologist.
But with every new physician comes a need for even more hard-to-find support staff.
You add a physician, in past you could get a nurse right away. Now it might take 3 weeks or 4 weeks or 6 weeks to get a nurse to come.
Because that's the biggest thing our workforce needs now, is they need that additional help. And so what can we do to get really more hands to help make the work a little bit lighter?
From scholarships to sign-on bonuses and pay increases, both health systems are getting creative to continue recruiting the workforce needed to serve the growing community while still dealing with the impacts of the pandemic.
3 weeks ago, we had 600 people out with COVID, and so that is hard to take care of patients when you have that much workforce that is out of the office.
The pandemic has also helped Avera and Sanford recruit healthcare providers from other states.
We have seen numbers of people wanting to leave bigger cities for South Dakota this past year.
We're contributing to that growth in Sioux Falls, but Sioux Falls is just such a great story. It's a great place to raise a family. We've got a lot of things to be proud of, and it is a very attractive opportunity for physicians.
Now, a lot of the healthcare growth in Sioux Falls has been in specialty fields like orthopedics, GI, or dermatology. Both Avera and Sanford say it is possible the city's continued population growth could lead to even more specialty medical fields coming to town, and that would make Sioux Falls even more of a regional hub for healthcare.